and I will see if we can make the translation work for people who speak Spanish. We'll try to make it possible for everybody to participate. But I just wanted to, first of all, I'm going to introduce Maria Eugenia Montesinos. Everybody knows her in the vasectomy world, and everybody knows her in the partera world. In vasectomies, and she thinks that it is possible that in the future there will be permissions for midwives to do vasectomies, which I think is a great idea, really a fantastic idea. And there's a lot of good reasons, and I'm sure you're going to talk about them. So I'm just going to pass the microphone over to Maria Eugenia, and I'll see about translating. And if we can figure it out, then we'll let you know. So, but for now, we'll speak in English and pass it on. There you go, Maria Eugenia.
Hi, everyone. My name is Eugenia Montesinos. I am a midwife. And actually, we're going to translate a little bit of, we're going to do in both languages. So at the beginning right now, I am going to introduce my colleagues who is joining us from Hawaii. Her name is Leah, and another colleague from New York City. So this conversation came, as Jonathan said, since I've been joining the group, this movement, and I think it's a fantastic movement for us to get into this, because we have such a close work with our mothers and with our families, and we think it's a great idea. So I will say, since I joined, I had many occasions that even my mothers or my patients with the partners, they were asking me why we would not do. I'm gonna just talk about one case that I have specifically, that I was going to Mexico, and I said, I'm going to Mexico now because I participate in this movement about vasectomy. And she says to me, really? So when you come back, could you do it for me? And I said, well, let's talk about when I come back. The main thing is that I'm going to this, hopefully by then you're not gonna have a baby, but we'll talk about when I come back. So went to Mexico, came back, they had the baby. We were so involved about that. We didn't even think about anything else until I saw them postpartum, and he says to me, so are you ready now to do my vasectomy? And I said, well, no, I can't do it because my institution, which is the College of Nurse Midwives, they did not allow it yet, maybe in the future. But I said, oh, but you already went to the training. How come you're not going to be able to do it? I said, I can't. So anyway, I contacted one of our vasectomies, I think Sarah Miller, at that time she was working with Planned Parenthood, and he was very happy once I saw him, and he says to me, oh my God, that was the best thing I ever had. And even have my doula, somebody was holding my hands, and I loved it and all that. So that was the case that why we should get involved, because they have such a closeness to us, and we can, they trust us. And the whole thing is that we take care not only of the woman, but we take care about the family. And I think the role is changing. So I'm gonna just change it a little bit now in Spanish for the Spanish-speaking participants. So, soy María Eugenia, soy una partera que vivo en Nueva York, y estamos presentando esta noche para una conversación acerca de la participación masculina en la planificación familiar. Yo me había unido con este proyecto porque me encanta saber que también el hombre debe de participar y darle la voz al hombre. Quizá no hemos tenido la oportunidad de darle la voz al hombre y ahora queremos que eso suceda. Entonces, les voy a presentar a mi colega de Chile, Sandra, y mi colega de Hawái, se llama Lea, y yo y Melissa vivimos en Nueva York y trabajamos en Nueva York. Le describí el caso de que tuve, por qué queremos participar, porque teníamos Yo tuve una pareja especialmente que me recuerda mucho porque él quería que yo le haga la vasectomía porque le había mencionado que yo iba a ese grupo. Y bueno, le expliqué que lamentablemente no lo puedo porque mi colegio todavía no lo permite. Entonces, esta es una conversación que estoy entrando y yo creo que somos las personas más indicadas porque no solamente vemos a la mujer, sino vemos a la familia y en realidad hacemos un cuidado general, primario y necesario en todo, no solamente rural, urbano y todo eso. Son mis colegas les van a dar algunos casos un poquito más qué hacemos, qué no hacemos y qué debemos hacer y cuál es el futuro. Melissa, voy a pasar a Melissa, que también trabaja aquí en la ciudad. Ella lo va a hacer solo en inglés y luego pasamos al resto de nuestras colegas. Melissa.
Okay, I can do it when you figure it out.
Yeah, no,
Yeah.
Hi. Can you hear me? I didn't catch what you just said. I'm sorry. It was a little bit broken up.
I was just introducing to you about the cases that we have in New York City and how we take care of New York City and what the family is and what the number of families that we see and all that.
Okay. Yeah. So, yes, thank you. So I'm here in New York City. I practice currently in the Bronx for one of the city's hospitals, which basically means we see patients from all over the world, right? And as patients, you know, coming from all over the world, from every different backgrounds, and you know, predominantly we do take care of all of the contraceptive needs currently of, as Johanny said, the female, you know, reproductive patients. So that means currently we've been all long able to place things like IUDs and implants for our female patients. And often it comes up about whether or not, you know, what contraceptive options there are for men. There's only so many. And of course, we don't have the ability to place. So we usually have to make a referral process and hope it's followed up. So I do think it's interesting to look at the idea of how to make something a bit more streamlined, that if a family is coming to you for care, how we can make it that it doesn't have to be something where you have to send the family away, that the patient and, you know, the partners can stay with you. So I think that's a really interesting thing to explore, and thanks for having me here.
Thank you, Melissa. And I think we're going to Hawaii. Leah is going to be talking a little bit about the things that faces in Hawaii. And so, Leah. Go ahead.
There we go. Thank you. I met Eugenia 10 years ago when she was my preceptor when I was doing midwifery in New York. I went there to do my training since at that time we didn't have midwifery training options here in Hawaii. And I've always been interested, you know, in learning that as midwives, we do family planning. Then to me, that really means for the whole family. And I was always interested in being able to offer options to our male community members as well as the LGBTQ population. And when I was working at a federally qualified health center, then I let them know, like, yes, I can see male clients for sexually transmitted infection screening and treatment and family planning. And so often I would get males in my office starting for STI screening and or treatment. But when they were there, then I would talk with them about family planning, and they would become more interested and oftentimes would book additional appointments to start seeing me for family planning. And I remember one time when I later was working at a hospital that I saw a family come in for delivery, and the husband waved at me, and I smiled and was very excited for him because he had been one of my family planning clients. And one of the nurses said, "Oh, did that used to be one of your moms?" And I said, "No, I don't know her. I only saw the husband." And so it's just that, you know, also that the families can, you know, they come to the appointments and they make those relationships with you. And so they do feel comfortable to talk with you. And when they're ready to choose to explore vasectomy, and when they feel like they're done with their families, and that they're, or not done, but excuse me, complete with their families, that, you know, they do ask about that. Is that a skill set that we can do? I've always been interested in being able to offer that. We have rural areas in Hawaii, and who are either experiencing homelessness or who are at risk of homelessness. And so with those families, it's even harder for them to gain access. And it was wonderful that Eugenia had shared with me the World Vasectomy Day. And last year I was watching some of the live vasectomy procedures, and I was just thinking, I could do this in somebody's home. And why can't I be doing this? You know, so it really is something that I would love to be able to offer and add to our skill set. And the curriculum is there, the training is there. We just, you know, need to be able to really get our organization nationally to say, like, yes, this is a skill set that midwives can add, so that we truly can be offering additional services to communities that we're connecting with. And I feel like that is what's really important, is the relationship that we build, and that trust, and then the ability to go into many places that otherwise some people don't have access to. So I just wanted to share that, you know, we do face barriers, as many people do around the world, but that we are a ready and willing workforce, and that we are very skilled clinicians, and look forward to be able to offering these services to people in comfortable ways that help them feel safe and welcome to come.
It would be so exciting. And you know, the other thing is that it's the perfect time. Once a family's just had a child, this is the time when they might really say, you know, this is enough. You know, it's a time to make a decision like that. I think people might be more primed. And so midwives would be the closest thing to that couple, that, you know, a couple making a decision rather than us just talking to men, or, you know, sometimes talking to women, because we do incorporate, you know, we do International Women's Day. We're all about women too, but it's hard to get the couples. And a lot of times I think that might be where you guys can come in. You know, I assume, at least in most midwiferys, that there's a time where the guy comes along too.
One of the, I'm gonna just jump in quickly, and why it's so important about this. Midwives are working around the world in areas that sometimes they don't have an access. They don't have any kind of access to any kind of providers, and it's a really remote rural areas, and that is why they have a midwife. So you can, let's say India, let's say Thailand, let's say these places which you don't even have a doctor. Right. In Africa. So you have the closest that you're gonna have is gonna be a midwife, because she's gonna be there delivering a baby. So right. Midwives sometimes become the number one provider. When something happens with them, they run to the midwife and they say, this is wrong, this is what is happening. So if we get into this is just a help to the mothers and the families, the humanity, which is more helpful. And I think for me, it's facing not only about a woman and the family, it's the environment, it is about the rights for, you know, for every single thing, and a woman, and sometimes the poverty doesn't make you accessible to contraception, and then you ended up having with 10 kids, which you didn't have access to that, not because you wanted 10 kids, it's just you didn't have access to contraception. And if we go to all those things, we can help in so many other ways. And I think that is why this is an open conversation, and see how we're gonna go. I think we have very interesting points from our next speaker, who will be the next guest, Sandra from Chile. And she has so many stories, so many points that she will go and say how we're gonna be changing in Latin America. And so here is Sandra.
Well, first of all, I really want to thank Jonathan and Eugenia for this nice invitation, and also to my colleagues here, and Also, there's someone from Chile here, also a colleague that joined us. So I'm really happy to be with you today, also celebrating this, World Vasectomy Day. So I would really appreciate if you let me share my presentation, because I have a small presentation to share with you.
When you share screen here, can you let share screen? Silas, we're gonna let you share the screen. You need to share the screen. We want to share the screen. We're gonna do it. Give us 2
Yeah.
seconds.
Yeah.
Just let anybody share the screen. Just give us 2 seconds and then there we go.
Yeah.
You can share it.
Okay, great. So, well, when Eugenia talked to me, she said that she wanted us to share how it was for us in South America, just to let us know, that we should be thinking, or sharing our experience regarding family planning and the strengths and challenges that we've been having. And also, at some point that, she made this question, what if midwives could perform vasectomies? Actually, I was like really surprised when she came up to me, of course, with this question. And I was, of course, wondering and talking to my colleagues. And then we wanted to share with you this, just to let you know how is the life of midwives down here in Chile, in South America. So this presentation we'll talk about a little bit to learn about the strengths and challenges of Chilean midwives and family planning, and also to reflect on the possibility of midwives performing vasectomies. Bueno, y como decía en español, muy agradecida por estar acá. Cuando María Eugenia me preguntó si queríamos, qué pasaba con las matronas y qué pensaba en realidad si podían hacer vasectomías, igual me sorprendí y me hizo reflexionar, conversé con mis colegas para ver qué podíamos compartir en relación a los desafíos y a las cosas que nosotros habíamos logrado en Chile como matronas. Por eso en esta presentación vamos a un poco de eso y además reflexionar un poco en relación a qué pasaría si las matronas pudieran hacer vasectomías. In this picture you can see Chilean midwives. We work in the whole scope of practice in family planning, antenatal care clinics, and well, the whole cycle of life of women. Also we're working with diversity now, and then we have midwives everywhere in the hospital, antenatal clinics, and also doing, for example, ultrasounds, working with adolescents. So our work is really full of different, activities regarding our scope of practice. Bueno, el rol de las matronas en Chile es muy extendido, trabaja en todas las áreas desde, ¿no es cierto?, del ciclo de vida de la mujer completo, incluyendo adolescencia, ¿no es cierto?, la anticoncepción, el embarazo, el parto, posparto, climaterio, incluso ahora campaña las mujeres en el envejecimiento, e incluso también ahora trabajando con la diversidad. As you see here, our role, has been evolving, but we've been working as direct entry midwives at the university for 187 years. We started working starting in 1834. And at the University of Chile was the first place where midwives got trained, and since that, as I said before, it's 187 years. In Chile, where we are 13,000 midwives distributed in the whole country. 98% of the whole professional care of women during pregnancy, childbirth, and postpartum by midwives. 100% women are, the 3 lowest income quantiles are seen for a midwife, for a doctor, by midwife, sorry. And of course, our association is really strong and is really respected in Chile. Como ustedes ven, las matronas en Chile llevan aproximadamente 187 años, somos aproximadamente 13.000 matronas y casi el 100% de las actividades las desarrollamos en todo lo que es, ¿no es cierto?, el parto, el embarazo, y el 100% de las mujeres reciben nuestra atención y la voz de las matronas es muy respetada. When I was thinking about the Maria Eugenia's question about, if Chilean midwives or Latin American midwives could perform vasectomies, then we were thinking, and I thought, why is that, Chilean midwives are so strong? Then I just was thinking about the pillars, and the first pillar is education. You can see here that midwives are educated in 8,000 hours in undergraduate midwifery training. It's a 5-year career, direct entry, and we are bachelors, midwifery at the end. And so, and we are trained in all these areas, especially in family planning and gynecology. And of course, regarding men, we are trained regarding, working with diversity, but not so much. But I'm sure that if we would really be thinking about vasectomy, would be very interesting to know that of course, we are also able to do it, because we are, working this whole scope of practice, and we dedicate many hours to be trained. Entonces, como ustedes ven también, una de las cosas importantes de las matronas es que uno de los pilares más fuertes es la educación, con 8.000 horas de entrenamiento, de formación, de pregrado, que principalmente están en todas las áreas, como ven, neonatología, obstetricia, ginecología, salud pública y, por supuesto, planificación familiar. La diversidad es uno de los elementos también que se entrena. Y as you see here, also one of the other pillars and the reason why we are, we're really strong down here is the regulation. And I think this is a really key issue that we have to consider if we think about midwives doing vasectomy. For us, it's been really hard, to keep the strength our work, because we're always fighting for regulation, for strong regulation. Actually, have 9 norms, as you see there. The first one is family planning, and also HIV/AIDS, STI, sexual violence, childhood, etc. And you can see there that we are there sitting with the Minister of Health, because every time that something is not going right, the associations goes and sit, and we're really strong there to maintain, of course, our work always being protected. Entonces, como ustedes ven acá, una de las cosas muy importantes es la regulación, y para poder incorporar otra práctica debería haber regulación. Para nosotros las matronas en Chile ha sido muy difícil, muy importante. Como ven, tenemos muchas normas y leyes que nos regulan, y tenemos que sentarnos a la mesa para hablar con el ministro de Salud, como ven acá, las matronas de la asociación, para poder siempre estar preocupadas de que esta profesión se proteja. Y como ven acá, and as you see here, also in family planning, midwives, as I talked before, where 100%, of the pregnancy was attended by family planning. This is from this year, and from the year 20, yes, and February was 91% of the family planning attentions were done by midwives. So midwives are all around the country. So it's a long country from the north to the south. And as Maria Eugenia said, midwives are everywhere. No one else is there but a midwife. So this is why it would be very important, and also would be, I think, really helpful if midwives would also learn some other things, some other ways to also, support families, and of course, men in the family, in their family planning decisions. Y como ustedes ven acá, también la proyección en Chile en relación a lo que es planificación familiar también alcanza un 91% de la atención de las matronas, es muy importante. Y como decía María Eugenia, también las matronas están en todas partes, del norte al sur, en Chile especialmente, que es un país muy largo. And one of the key things, I think, if we want to think about midwives doing vasectomy is, of course, it's a strong pillar, is association, midwives associations. We have to have a strong associations to fight for our rights, to fight for sexual and reproductive rights of women and men and their families. And as you see here, all these midwives are around here. They are midwives representing the different, the National Council that is made of all the midwives, the presidents of the regional midwifery boards from the whole country. And as you see there, in the picture in the middle is the Minister of Health, actually the current Minister of Health. And we are having this meeting with him, also, advocating for women's rights and for midwives, because actually during the pandemics, we've seen a pushback of sexual and reproductive rights for women, for men, and this is not right. So we are always fighting down here. So if it's related to having a new, una asociación fuerte de matronas, como ven, este es el Consejo Nacional de las Matronas, representan a todas las regiones de Chile y ven al medio al ministro de Salud, el actual ministro de Salud, en que estamos, ¿no es cierto?, haciendo una reunión y haciendo abogacía por los derechos sexuales y reproductivos, la planificación familiar de las mujeres, sus familias. Y si tuviéramos que pensar en agregar una actividad más en relación a lo mejor a las vasectomías o, ¿no es cierto?, la planificación familiar de los hombres, seguramente también tendríamos que sentarnos a la mesa para poder hacer este camino. And lastly, if we ask ourselves what will midwives need to be able to perform vasectomies or challenges for us, down here in South America, now you can see here all the challenges that we have. Firstly, we have to strengthen the midwifery model of care, of course, from undergraduate education. We think that that's really important. First of all, you have to train midwives from undergraduate and of course postgraduate, especially if you want to be training them to perform vasectomies. We also need new or updated regulations supporting autonomous practice and new activities in family planning. This is really important because of course we can train many midwives, but if you're not regulated, they're not going to be able to perform any vasectomies in the country. So this is really important to also start at the same level, working with regulation, with the government, Minister of Health, to let midwives to perform, in this case, vasectomies. To strengthen the work with civil society, women and men's groups is really important, especially in South America, because you know that here in South America we have a really strong men-centered culture. So of course we have to change men's minds and women's minds also. So we actually need to work really strong with them. Strengthen the work with, of course, with the sexual diversity. We are doing it now, as you see there. This year we celebrated with them, and we have a really strong work right now with them. So there's a door open also, and we are sure that many will be really happy. We will start working, and performing vasectomies. Of course, strengthening sexuality education and promoting sexual and reproductive rights is really important. It's basic. It's the basis, I think. So in that way, we really have the strength in education. Strengthening teamwork with health professionals, because we want to be part of a team, we want to be respected, and also we want to see that we are sharing maybe some activities, but of course everyone has their place. And of course, lastly, we also need to access to training to new family planning activities that include men's in this case. But one of the things that is really important also is to practice based on evidence. And that means, that we have to perform research. Como ustedes ven, y finalmente, ¿qué necesitamos entonces para poder realmente hacer vasectomías? Primero que nada, una educación fuerte, ¿no es cierto?, desde el pregrado. Regulación, que pueda desarrollarse simultáneamente. Fortalecer el trabajo con la sociedad civil, grupo de mujeres, hombres, también la diversidad sexual, como lo estamos haciendo nosotros ahora en Chile, que estamos trabajando muy fuerte con ello, fortaleciendo la educación sexual y promoviendo los derechos sexuales y reproductivos, que en este momento en Latinoamérica han estado muy afectados por la pandemia. Ha habido un retroceso en lo que son los derechos sexuales y reproductivos, fortaleciendo el trabajo del equipo de salud para que podamos ser respetadas, porque es muy importante, ¿no es cierto?, el respeto a nuestra labor y también el respeto de la labor de los otros profesionales. Y por supuesto también teniendo acceso a nuevas formas, ¿no es cierto?, de tener planificación familiar que incluyan en este cuidado a los hombres también como un centro de la familia, como un centro de la relación de las parejas también. Y por supuesto todo esto basado en la evidencia. Para poder avanzar hay que hacer investigación para que podamos generar nuevo conocimiento. And so finally, as you see here, this is, the last slide. In the left, you can see this. This is the government house. It's called La Moneda, and you can all this red, color red down here that you see all these balloons. These are midwives. This was when we were fighting for our sexual and reproductive rights, and also our rights as midwives. We always, have this massive, reunions, and every time we do it, we also, get hurt. We are hurt, but it's really difficult. We don't want to get to that point to be pushing all the time. We have to be fighting. We've been fighting for 187 years. So if it's time to fight for men, we will do also. And in the left and the right, you see a midwife also working with men, because we work at the HIV clinics, so that she's there. She's really happy working with men. So we are already doing it. So why not? We could also join and be trained to join, this vasectomy group. And finally, today we call on midwives around the world to speak out for universal access to voluntary family planning and birth spacing, because this could prevent 87 million unwanted pregnancies and reduce the rate of unsafe abortion worldwide. And of course, we also want to advocate for men's sexual reproductive rights and access to vasectomies. Y como ven acá, finalmente agradecer a todos. Aquí ustedes pueden ver la foto de las matronas luchando, peleando y vestidas de rojo frente a la moneda, que es la Casa de Gobierno. Hemos siempre salido a luchar por los derechos sexuales y reproductivos de las mujeres, las familias, por nuestros derechos, y no nos gusta llegar a ese punto, pero lo vamos a hacer, y si es necesario luchar también por los derechos de los hombres, y el acceso a la vasectomía también lo vamos a hacer, vamos a estar ahí. Y a la derecha ven a una matrona muy feliz atendiendo a un hombre en las clínicas, ¿no es cierto?, de atención de infecciones de transmisión sexual y VIH, y hacer un llamado también a todo el mundo, a todas las matronas del mundo, para realmente seguir haciendo abogacía, para que exista acceso, ¿no es cierto?, a la planificación familiar voluntaria, a la vasectomía para los hombres, y en este caso, porque puede prevenir 87 millones de embarazos no deseados y, por supuesto, reducir el número de abortos también inseguros. Y, por supuesto, abogar para que pueda existir el acceso a los hombres a estas nuevas tecnologías. Thanks a lot. So thank you, thanks everyone, and actually I think this is really important to have in mind. These pillars are so important: education, regulation, association, research, and of course, advocate. We have to advocate strongly, and I think it's really important to move forward with all the different levels at the same time.
Have you heard?
Yeah, I think we are having the best allies, not only for being providers, but the best allies for our women, for our family, and best allies to change the world, and the best allies of equality with equity, and that is what we are for. And it's been a pleasure that you open up an invite to the midwives, and I think it's an important role that we can play on.
Can you hear me all right?
Yeah.
Yep. I would, for a couple of things. The first thing is, we could go on for a while. I wish we had more time, because I think we really need to, the main thing is we couldn't help with training, because obviously in Chile you have a great system, but in some parts, really to train in vasectomy, you don't need to spend 8,000 hours. If you do 20 cases, if you can do 20 cases, you can do that in 2 or 3 days. We just finished a program in Bolivia where we were training 4 doctors. There were 2 or 3 obstetrics, and then 1 family practitioner. Up until then, in Bolivia, it had only been urologists, and the urologists charged more money than they could charge their patients. So they lose money with every vasectomy. So they decided we would train their doctors, who were their in-house doctors at Mari Stopes. And we told them that we would do a training, but they needed to have 20 clients per trainee. So that would be enough vasectomy so that they could get started. And we work with them, but they were mostly their own. And they ended up getting 127 clients for 4 doctors. And they have 600 more men waiting to get vasectomies from these doctors who've been trained in under a week.
Wow.
So you guys could be trained within a week. You could be trained. And also the one thing, and I know I don't always speak about, I don't know what people think, but in the United States, a vasectomy, a lot of people are charging $800, $1,000 for a vasectomy. It takes 15 minutes to 30 minutes to get a vasectomy. You guys sometimes you're getting that much money to deliver a baby, and that takes a lot of time and effort. So a vasectomy added to your practice could also make it more affordable, to make it a livable wage, that you could be offering vasectomies. And obviously in other places, it's not as much. But anyhow, it's something that we are happy to advocate for. I know Escar might want to add, but I was curious if Chaim is still there. I'm wondering if there are people from the next group is speaking from the Philippines, and was just curious to hear about the Philippines. Yeah, Chaim, there's Chaim.
I think Esgar wants to say something.
Yeah, but I just wanted to introduce Chaim, who's been waiting at his time. But Chaim, it's glad to see you. Chaim's with DKT, the Philippines, and the DKT Philippines is the DKT is one of our big partners. And yeah, I just wanted to hear what Chaim thinks about midwives doing vasectomies, if that would even be possible in the Philippines.
Hi, everyone.
Hi.
From here in Manila. And well, I don't know, Jonathan, the midwives in the Philippines, I honestly don't know whether their rules and guidelines of practice would allow them to perform a surgical procedure of that nature. They do insert IUDs and have the ability to do that. But we have a few guests and speakers lined up here in the Philippines who may be able to talk directly to that point.
Cool. Before we pass over to the Philippines entirely, I know Escar wanted to say something, so let me let Escar jump in. And Escar is actually in his mobile vasectomy clinic in Times Square now, and has been driving around New York City and stopping at Wall Street. And behind Escar is Doug Stein, who's there smiling in the background. And Doug is the man who got World Vasectomy Day started with myself when we made a film with him, which we started the film in the Philippines. That's how we all started. World Vasectomy Day really started in the Philippines. And that's a kind of interesting little fact. And Escar, I know you wanted to add something before we switch right over to speaking to the guests from the Philippines.
Well, I just wanted to thank you for that presentation and the work that you guys do. You know, as somebody who worked for several years doing obstetrics and taking care of young families, all the effort that you put on what you're doing is fantastic. At the end of the day, we all share similarly the enthusiasm for vasectomies, but some of us have this particular passion about the fact that we want to change, we want to close that gap that exists between men and women in terms of the participation in reproductive health. And knowing the work that you do, because I've worked with midwives for a long time, and knowing that actually most of my referrals come from midwives because of the relationship that I have had with them. I think that considering what you guys were discussing is a very powerful it's a very powerful idea, and I commend what you do. I think I just wanted to make that comment because I know what you guys do, and I know the advocacy work that you do with women, because I was talking with Eugenia last night actually about that. And the beautiful thing about that relationship that you establish with your patients is that you become allies with the patients. You don't tell the patient what to do. You tell the patient, let's go together. Let me hold your hand and we'll go together through this process. And I think that is what allows you to have such a wonderful relationship with not only the patient, but everybody else inside the family. So that's wonderful what you guys do.
Excellent.
Doug wants to say something.
Thank
You know,
Thank you.
our most spirited vasectomy provider in Haiti is a family medicine doctor who takes care of families in every way. And I have been trying to get other doctors to be as active in vasectomy as he is. And there was even a urologist there. And the urologist does a good job. He's not as experienced as this one person is, but we're trying to figure out why he's so prolific and the other doctors are less so. One's a general surgeon and one is a urologist. And he said, because I take care of them. I take care of the families. So they trust me. He doesn't have to refer them to a stranger to get their vasectomies. And if the midwives get all credentialed and ready to go doing vasectomies, you'll have the same advantage over all the specialists. Even if your referral source is a family medicine doctor, it's a new face. But you are a familiar face, and that trust is invaluable to developing your vasectomy practices. That's all I have to say.
All right.
Actually, down there, actually in Chile, many of my colleagues are just, expecting, when are we starting to be trained. So I'm sure that the ones that are here listening now must be really happy. And of course, we're looking forward to work with you strongly. And of course, to support this movement.
Well, we welcome you guys to stay on. We welcome them to continue to be part of the conversation, but I'm going to pass the microphone over to Chaim. And I know that I gather the moderators, Robbie It's glad to meet you, Robbie. But I'm going to silence my mic and open the mic to you guys and go right ahead and take us there. I just, as I did say, the Philippines, we went there, I think it was 2011, Doug and I went. Doug was going already. He was working in Cebu, and the program was really good, kind of blew my mind. And that's how I started. I was making a documentary about Doug and the vasectomy world, and that's how